A quick dive into health and safety. A bit much. Academic makerspace health and safety. Better. So, an outline to help highlight what you might want to look into in future. I'll mostly be looking at EU and UK regulations, and what I'm talking about is subjective in my own knowledge. I'm going to talk quite fast. Let's go. Documentation. So you're going to want some documentation logs to keep track of all the stuff you're working on or plan to work on. And what's going to go in that is your control of substance hazards to health, your COSH, where you've got your chemical hazards and you're looking at the risks, how you're controlling them. Your risk assessments, all of your risks and how you're controlling them. Your safe systems of work, where you're looking at what you wrote in your COSH and your risk assessments and you're bringing it together in a guide of how to work safely in those processes. Chemical logs, where are your chemicals, what are the hazards, how are you storing them? Personal protective equipment, maintenance logs. How can you format your approach for minimal work but maximal output? I'd recommend categorizing by control measure. So I've got all my 3D printers, one COSH to cover all of my 3D printing materials instead of 30 COSHs, one risk assessment to cover all my 3D printers, and addressing those differences in that single document, more likely to be read, less paperwork. Risk awareness training is really important. For example, the IOSH training is really good, so you can know what all the risks you need to be aware of are. Moving on, FDM 3D printers and the emissions that come off them. So volatile organic compounds, VOCs, generally come off in very small amounts. Some you don't generally need to worry about, although some people will try to sell you carbon filters. Unless you've got ABS printing in mass volume in very small amounts of spaces, you don't need to worry. Ultrafine particles you might have heard of, they're not well understood. The research isn't there. There's not landing legislation yet. We put HEPA filters on our printers that are printing ABS, nylon, that kind of stuff, just in case. Moving on to SLA, stereolithography 3D printing. The resin, it's skin sensitizing. You want nitrile gloves. You want protective eyewear so you're not injuring your eye. And when you're talking about the IPA, the solvent you might be using, we've switched to using TPM. It's not flammable, it's not volatile, it's not toxic, so you've got a lot less health and safety risks you need to worry about. Safety data sheets. For any substance you receive from a supplier, it should have one, and it should meet these regulations and standards. You can send them to them if they're not doing it right. Chemical storage, if it's flammable, for example, put in a flammable storage cupboard, have a spill tray. On the subject, have chemical spill kits available, so you do have a chemical spill, you can clean that up. Your safe system of work should cover your emergency procedures. Moving on to laser cutters and engravers. I'll call out specifically thinking about how long you should have your hood shut before opening it after a cut finishes. I'd say 2 minutes based on this paper. And also the emissions. If you have a circulating ventilation unit that is extracting most stuff but recirculating the air into the same room you're in, it's not going to capture carbon monoxide. You might want to look into it. For everything else, I'd check out the British Standards of Laser Safety, and I'd have someone in your organization go on the appropriate laser safety training, for example, this. Moving on to soldering. We use non-leaded soldering. I'd recommend it. But even with that, you need to be concerned about the emissions from rosins. You might be using one of these, which the Health and Safety Directive call a smoke recirculator. It doesn't really do anything. I'd recommend some local exhaust ventilation, proper unit instead. On the subject, if you have local exhaust ventilation, every 14 months, you should be getting regular inspection and maintenance of that by a certified inspector. Moving on to noise. Have you checked how loud your stuff is? Your CNC mills, your ventilation units. Do you need to get hearing protection? Maybe. Moving on to health and safety accessibility. Do you have step ladders so you don't have to stand on chairs to reach stuff or hurt your back? If you have flashing lights on your 3D scanners, is that photosensitivity risk? If you have tight-fitting RPE, people with facial hair, do they need something else? Are you using nitrile gloves? Because if you're using latex ones, you might need to worry about latex allergies. If you have skin sensitizers, respiratory sensitizers, noise, vibration, you might need to think about occupational health monitoring in your organization. If you're exposing people to substances when they're working on a process, you might need exposure monitoring to check how much, check that it's not over the workplace exposure limits. If you have personal protective equipment, respiratory or otherwise, can we think about engineering or administrative controls that can replace it? Because they're generally better, you're eliminating the risk at the source. Accident near-miss reporting, loads of people are scared of it, but if you're capturing even small cuts from hand tools, you can check stuff over time and say, hey, do we need to improve our equipment? Do we need to improve our training? That kind of stuff. It's really useful. Provision and use of work equipment regulations, pure. You look into it for equipment safety, maintenance, inspections. On the subject, if you've got people using bandsaws, routers, you probably need to get them certified operator training for that as well. Dangerous substance and explosive atmosphere regulations, DSEER. If you've got combustible dust, wood, foam, metal, you need to think about this. Think about ATEX rated equipment and inspections. Thanks very much. Bye.